Hey everybody. I don't know if people are afraid to have these heartfelt conversations with people anymore or what, but this isn't even one example that I need to give. This is an everyday thing, at least on my end, from a CAT scan, from an x-ray end, and that's the fact that we have chronic obesity and we're scanning you for no reason, okay? People come in, I'm not kidding you, here's just one example. Girl comes in, I'm gonna call her Becky. All right, Becky. Becky comes in, she's under 40 years old and she's 400 pounds. She's complaining that her hip hurts, that she picked up a box of chapstick or a box of lotion, and now her hip hurts and her lower back hurts. Okay, so we're going to scan you, and it's one thing to have somebody who's normal size, at least normal from, even 50 years ago, because the new norm is changing and it's always changing. So before I even get into the Sue happy world that we live in, just think about for a moment that how much radiation you're getting. And this is why we're setting ourselves up for failure. Just because we don't feel it doesn't mean that it's not affecting our body. It's one of the major causes of cancer is radiation. So why are we signing up for it? Guys, you got to think twice. We've got to think twice. And we need to have these real conversations. And it's not fat shaming. It's not doing anything else except looking out for people's genuine well-being, people's real long-term health. And if we really are looking out for people's long-term health and their real general well-being, we shouldn't be afraid to say, hey, listen, we're going to be giving you this CAT scan from a doctor's perspective, from an x-ray perspective, from a nurse perspective, from your own perspective, from a family perspective. We have people in the emergency room, the family members are always there. So someone needs to be having these conversations and say something like this. Listen, I know that we're about to give you this CAT scan. Do you really think that it's spine related or hip related because you bent down? Or do you think that's more muscle related? Because 99 times out of 100, it's muscle related. It's a pulled muscle. Think about how many times we bend down forward every single day. We never lean backwards to relieve that stress, to relieve that pressure. So we just try to stretch, and when we stretch out our back, we're still stretching in the same direction that we're bending down in the first place. That tightens up the muscles over time. So going back to what I was speaking about before, someone needs to have a conversation with these people and say something like, listen, I know that we're about to give you this CAT scan. Do you really think it's necessary, given the fact that it's not always, but most of the time it's going to come back negative. Now, I did touch base a moment ago about the Sue happy world we live in, and that is absolutely true. So it sucks. We're in this catch-22. We have people who shouldn't be 400 pounds at all, and now they've hurt themselves, and they come to the emergency room, and we're dumbing our culture down, guys. We're dumbing down the talk. We're just treating symptoms, and on top of that, we're not having a conversation that we could really genuinely screw up your health long term. So I think it's okay to not hurting someone's feelings is being too strong, but at the same time, it's kind of just being blunt and saying the fact that, listen, I'd rather tell you straight to your face and tell you, listen, it's time to lose weight. And physicians, we can't tell you how to lose weight correctly because there's no nutrition in medical school. They get taught, here's your A, B, C vitamins. Here's a book if you want to look them up. Go on the internet if you want to look up more about them. It's back to pills and how pills and pharmacology works in your body. The study of how pills work in your blood and change your blood chemistry. And that's it. Nutrition has nothing to do with medical school. And I'm not knocking physicians at all. These are the most brilliant people we have in the world, the most dedicated, the most sincere people. But it just goes to the fact that, guys, we're all being played. We're all being played. We're all being pimped by the same people who make the rules, the same people who make the education system. We're all being affected by it. You have to remove yourself from that classical education and look at the nutrition as a major driving factor. And if someone really does have a box that falls on top of their hip from Menards or Walmart, okay, let's get the CAT scan. But if it's something where you're just overweight and your knees hurt or you're having back pain, we need to tell you, like, listen, you're going to have that x-ray done, and the amount of radiation you're going to get might set you up for something so much worse. The likelihood of you getting cancer, blood cancer, breast cancer. We scan people's hearts, we scan people's thyroids, we scan people's eyes, we scan people's sensitive organs, their skin. It's the largest organ on your body. We need to really consider the fact before we just sign up and say, okay, I'm going to get this CAT scan. And it's not your job, the general viewers to this, to know what the CAT scan is going to show and what it's not going to show. But when we're looking at something muscular because you're having generalized back pain and we're looking at a CAT scan that shows bones the best, get an MRI if you're going to look at muscles, ligaments, tendons, the things that come off, that branch off the spine. It's not right. It's not right. You need to remember that healthcare is a business first and it's taking care of you as a patient second. And I feel like no one just wants to talk about these things, you know, and it's really sad. But at the same time, like, if we're really genuinely concerned about people's healthcare, we're really concerned about people's well-being, we need to start having these real heartfelt conversations. It's probably the first sentence I said. And it's just really, really sad. And this is a daily occurrence. I mean, in one day, us as CAT scan technologists, we pull over 50, over 60% of our patients. And of those all pullovers from bed to bed, probably 70%, if I had to guess, are overweight, if not obese, if not morbidly obese. I mean, in one single day, we could pull over 400 plus pounders, 6. And they're all for back pain, things that are all related to weight. Because these people can't move on their own. Now they're diabetic, now they're hypertensive, and now all the things that come along with all that stuff. And it's just a real shame, man. It's like this is, we're dumbing our culture down, and we're not looking the problem right in the face. So now you're getting x-rays, you're getting unnecessary radiation, you're setting yourself up for failure in the future with cancer, with comorbidities, meaning that you have other morbidities related to your first one that you even came in with. Okay, CAT scan came back negative. Here's a pill, out the door you come. Okay, so now we're going to see you a week later because, well, doctor, the pain just didn't go away. Okay, we're going to look at you again. And now we're doing it all over again. Now consider the fact that if you are watching this and you are 300, 400, 500 pounds, think about how much radiation that is. Like I said, it's not your job. It's our job to realize how much radiation we're giving you. But we just go along with the flow. Everyone just goes along with the flow. You know, there's real information, there's real stuff that happens, there's real things that are going to happen and is happening to one of your family members, someone you care about. And now when we do get cancer, you know, say that same 40-year-old girl came in and who is the 400 pounds, and now she does come in, you know, at 6 years old, 7 years old, on top of being obese, on top of being diabetic, on top of being having high blood pressure. She probably has chronic deficiency of minerals. We're talking like vitamin D and magnesium. That's all it takes to have a break in your DNA and have cancer start forming as your cells keep dividing and dividing. So now we look at the fact that we got all this extra radiation from all these scans throughout the years, and all these pills and all these things that change our blood chemistry, and we wonder just where the cancer comes from. And now we're stuck in that victim mentality instead of, you know, we're all playing defense. We're all scared of our health. We need to be on the offense, guys. It feels so good to be on the offense of your health and be proactive. To be proactive and just hit it hard, man. To feel the energy of being optimized. Not just having enough, not being in normal range values of our blood, but to actually have optimum health. To have on the top range of the vitamin D, to have the top range of our magnesium, and actually feel what it feels like to have real, true energy and not need pills to, you know, or think about it. Like, what was alternative health before we had alternative health? It was real healthcare. It's only in the last 100, 150 years that we've really gotten into what is modern medicine. And so what really is the alternative healthcare? Really, we have such a brainwash, we have such a backwards mindset. And now we're thinking that things that were here since the beginning of time that really drive nutrition, that really drive our genes, that really drive our true healthcare. Now we're looking at these things and thinking these are alternative health. Okay, if you take extra vitamin D, if you take extra magnesium, if you supplement, if you take fish oils, that's alternative health? Get out of here, guys. This is real healthcare. That's the real, true driving health. The modern healthcare, the things that are synthetic analogs, because science can't figure out stuff that came from nature. It's too confusing. Your body's never going to get used to it. Your body's never going to get a resistance to the willow bark. So what we can do is Bayer, the aspirin company, is take a couple of those synthetic pathways out of the 300-400 that naturally occur in the willow bark, and we can make them in the aspirin and give it to you because we can't patent that tree and make money off you. Like I said a couple minutes ago, business first, taking care of you as a patient second. Never forget that. And so when we're looking at it like that, okay, now we're going to give you this Bayer, now we're going to give you this aspirin, now you're going to have side effects related to this, and now you're on a subscription service, right? You're taking it every day, you're taking it every month, you're taking it every year, and that's recurring revenue for the biggest players in the game. Anyway, that's all. I need to get that off my chest because this is real stuff that really happens, and we just need to really be looking at the major keys, guys. When we start looking at the major things, healthcare really isn't that confusing, you know? You eat right, you supplement right, you drink the right water, you protect yourself correctly, you're proactive, and you feel what life really is meant to be about, and you're happy. You know, we stop treating the soul. All we do is treat the body, and it's two totally different things, but at the same time, they're all connected. Your whole body's connected. and we're pulled in all these different directions, and then we feel divided, and then we're conquered because of that. Anyways, that's all. I know I went and started in one direction, I ended up in 2, 3, 4, 5 directions, which usually happens anyways. But hey, when you see as much as I do in a day, it's hard. It's hard, and people just need to be real with each other and not be ashamed to have those conversations and say, listen, we're going to give you this, but we're going to set you up for failure down the line. I don't think you guys want that for yourself. I don't think you want that for your grandma, your grandpa, your mother, your father, your aunt, your uncle, yourself, your child, you know. And it's just insane. So let's stop prescribing all the extra stuff. And I'm not just talking pills, I'm talking the radiation, I'm talking all the excess stuff. You know, healthcare is simple when we're treating root causes, when we're not treating symptoms. So let's change the mindset. Let's start looking that we go forward and or look in the correct direction that we're going forward in. And that's it. That's all I gotta say, man. So when I say it, as I say at the end of every video, protect yourselves. Protect yourselves. Literally, when you look at things on a cellular level, everything else starts working. All right, guys. Peace out. Be safe. Stay healthy. See you.